What a wonderful group so far. So I think we're just going to get started and kick off here. Quickly, just to introduce, where I feel very lucky is that we've been working really hard, that even if you can't see us in person, we've really been working on supplemental services into really providing you, regardless if you're unable to go to a Kindbody clinic, you still can really get an amazing Kindbody experience by seeing our virtual providers. And 2 of our 3 additional speakers are from our Kindbody team. And so I want to introduce first our therapist, who's been such an amazing support to our patient, Judy Cottet. She's joining us today. And then I have Krista. She was our very newest nutritionist to our team, and she's really going to talk about great foods and things that you can really add to your diet to help you with your cycle. And then I'm so happy we have Josephine Atlery. I got it. Okay, there we go. Sorry. Atlery with us today, who is going to really share her journey and all that she went through in her trying to conceive journey and how it brought her closer to mindfulness and really empowering others like through her journey through meditation, which is super magic. So we're going to talk about today just some basics of what you would kind of want to do to prepare for any sort of cycle or fertility journey. And then we're going to talk about nutrition, how stress can affect your cycle and things and tools you can use. And then tomorrow, we're really going to talk about how certain medical conditions can affect your fertility. And also we have an acupuncturist and our naturopath doctor who's going to talk about things that you can do with PCOS and endometriosis. So I've said a lot in a few minutes, but I'm really, really excited to introduce Dr. Meredith Brower, who's our physician here in Santa Monica, to really take us away and start this conversation. And again, feel free as we go along to drop your questions in chat. We'll try to answer them live, but then we'll also at the end go back through those and answer them as well. So feel free to drop things in there. We love hearing where everyone's from. Welcome, and thank you, Meredith, for kicking us off.
Thank you, Tracy, and thank you for that introduction. And I just want to sort of reiterate that Tracy and Rebecca and our team have done a really, really amazing job providing us as clinicians with all these really wonderful resources for our patients. So, you know, as somebody trained as a medical doctor, you know, we don't always get a ton of training in mental health or in nutrition or in mindfulness. And they're such essential parts of care that it's really nice to have these kind of experts by our side to really provide sort of well-rounded care for our patients. So I have more and more every day I see patients coming into the clinic and they've already attended an event or maybe even accessed already seen one of our virtual nutritionists or therapists. And it's such an amazing resource. And so our goals for today are, and you know, one of the most common questions I get are, well, what can I do? You know, what can I do to improve my fertility, or you know, what can I do on my end? And so I think that's where a lot of these supplemental sort of supports come in. And so we have, like Tracy mentioned, some really wonderful people here today to talk about those things. I'm going to start by introducing you to Kindbody and what we do here. We'll talk about sort of things from a more medical perspective that are sort of do's and don'ts for when you're trying to get pregnant or when you're preparing for a cycle. And then we'll speak to our experts about nutrition and mental health and mindfulness. So, you know, Kindbody, we are a full service center for women's health and particularly reproductive care. Our mission is really to provide care that is unintimidating, that is accessible, and you know, we want to provide care in a way that is easy to access and feels safe and comfortable, and provides, as we've said multiple times already, sort of addresses people as a whole people. And so that's what we do here. Again, here's a list of some of the services that we offer, but we do everything. We meet with people who are planning to get pregnant and just want some of this information that we're going to talk about today. How do I optimize myself, my body, in preparation for being pregnant? We help take care of people who are trying to get pregnant and having a hard time getting pregnant. We take care of individuals and couples that are using third-party reproduction, egg donors, sperm donors, and people who are planning to preserve their fertility. And then again, all of our ancillary support and services. It's all part of what we do here at Kindbody. So the first step, I think, kind of always, no matter where you are in your journey, as I mentioned, if you're just thinking about getting pregnant or want to learn more about yourself or just want to learn more about your body and your reproductive physiology in general, is to have an assessment, to meet with a provider, one of our providers or a provider somewhere who can talk to you and get to know you, get to know what your reproductive goals are, and then again, give you information about your fertility, your body, and your general reproductive health. And that starts, just like I mentioned, with an appointment. Things that will often get done at this initial assessment are, like I said, probably the conversation is one of the most important things, the information sharing between you and the provider. We're often assessing for females ovarian reserve, so trying to get a sense of an individual's egg numbers, because that's an important component for fertility, and certainly a very important component when people are doing treatment cycles. We focus a lot on preconception, making everything optimal from a medical standpoint in preparation for being pregnant. And that often includes, checking on thyroid and vitamin D levels, making sure you're not anemic, that, doing genetic carrier screening. So again, just so from a medical perspective, optimizing for pregnancy if you are planning to be pregnant. We also, do assessments of male partners, and as well as the uterus and the tube. So those are all things that might get done at initial assessment at a Kindbody clinic. Treatment options, again, I won't go into too much today, but we do sort of do everything. We can help you get pregnant, we can help you preserve, and we can just give you information. So those are all kind of the things that we do in the way of treatment. Tracy and I were talking about this yesterday. We're still living. When sort of the quarantine first started, we did a lot of events that were very focused on this, and I think sometimes it's easy to feel like, oh, life is going on as normal, but we are still living in this very unique moment in time, where we're dealing with a pandemic and the fear of COVID, and so we've made huge efforts in our clinics to assure the safety of our patients and assure the safety of our staff. And I think we're doing a pretty good job on keeping everybody safe and making everybody feel safe. But we are still fully operational, and just kind of things just look a little different than they did 6 months ago. So I'll just start with a few little simple do's and don'ts before entering any kind of treatment cycle, or even in preparation for being pregnant. So you'll see here, I list a couple of don'ts. Alcohol consumption. So I think it's pretty intuitive that once you're pregnant, the general consensus is that you should not be drinking, but there's also really good evidence that heavy alcohol consumption is negative for fertility. So we do recommend limiting alcohol consumption to a very moderate level. I don't know if you have to stop altogether. Again, as Tracy's fertility journey was 10 years. So sometime, your fertility journey might be a month, and it might be 10 years. And so to have people have to stop altogether is not always realistic, but certainly very light alcohol consumption is ideal. Caffeine, less than, we'd sort of say 1 cup of coffee per day, but limiting caffeine, and certainly marijuana and tobacco are sort of things certainly to avoid in order to optimize fertility. Things that are good for you, which are things that we're really going to talk about in more detail today, is maintaining a healthy diet. Nutrition is extremely important for fertility, and we have a nutrition expert to talk more to us about that today. Exercise. exercise is good for you in every way. It's good for your mental health. It's good for your physical health. It's good for every part of you. Both of those things sort of come into play with maintaining a normal BMI. So there is very good evidence that having a BMI of less than 30 results in improvements in fertility and certainly improvement in treatment outcomes. So that's one of our general recommendations for pregnancy, in addition to improved pregnancy outcomes, so minimizing complications during a pregnancy. One of the supplements that we commonly recommend is a supplement called coenzyme Q10. And there's actually some good, it's an antioxidant. It's probably good for things other than fertility, but there is some good evidence to suggest that it's helpful for egg quality. Stress management, I won't talk too much about that because we have Judith who's going to do a whole segment on managing stress, and really our mindfulness segment as well kind of will play into that. But, you know, trying to get pregnant, doing fertility treatments is an extremely, extremely stressful experience. And I think there can be, I actually had a patient say to me just yesterday, you know, I'm trying to get pregnant and everyone just keeps telling me to stop being stressed out. And I think in that, I hear that all the time, and I had personally experienced that. And so I always say, you know, managing stress is important, and it probably is important for fertility, but certainly you shouldn't feel blame, or you shouldn't feel as though, you know, if you just weren't stressed, you would be pregnant. And I think that people don't realize what an insensitive thing that is to say to people. So I also, and although it is very important to manage stress, and we want you to have all the tools possible to manage your stress as you do treatment or try to get pregnant, we don't believe that you aren't pregnant because you're stressed. And so I think that's really important to remember. Acupuncture is an important component of treatment. We're going to talk a little bit more about that tomorrow. We have one of our wonderful acupuncturists talking to us about acupuncture in great detail in our segment tomorrow. And then track your cycles. This is a simple thing to do. There's about 300 apps, different apps you can use on your phone, Ovia, Glow, Flow, there's a million. Understanding what's happening in your menstrual cycles can be very, very helpful for your physician or your provider, and helpful for you as well as you try to figure out how and when to have timed intercourse. During a cycle, so if at some moment you do find yourself doing a treatment cycle, some of these recommendations are very similar. The alcohol, caffeine, marijuana, tobacco, those are all sort of carry over into your treatment cycles as well. There's generally some other recommendations that we make that are more specific to that acute period of time when you're in treatment. There will be a period of time where your provider has you avoiding high intensity exercise and avoiding intercourse, and that's in an effort to keep you safe as your ovaries might get enlarged from a treatment cycle. And then really for all our pregnant patients and those who are doing cycles, we really try to, I mean, we are all trying to be as safe as possible all the time, but certainly during those periods of time, it's probably especially important to be practicing social distancing and wearing masks and minimizing your exposure to COVID infection. Over on the do list, we have, you know, again, some similar things, maintaining a diet that's nutritious and healthy, lots of sleep, lots of hydration with electrolyte-rich fluids. We'll let you do some low-impact exercise, but again, we will be also giving you recommendations to protect your ovaries, and then just to communicate with your team, you know, especially at Kindbody or wherever you are, but at Kindbody, you will have a huge team that's a part of your support network, and will want to know what's going on with you so that you're not feeling alone. And I think that's kind of all I have. I am going to throw it over here. We're going to talk, we have Krista with us today, and she is one of our really amazing virtual providers. She's a registered dietitian with an expertise in fertility. And she's going to talk to us today about how you can use food and nutrition to optimize your fertility. So Krista, we're so excited to have you here. Thank you.
Hi, everyone. Thank you so much for having me. I'm super excited to be part of this amazing community with Kindbody, and also to be part of this series of events. My name is Krista, and yes, I am a fertility nutritionist here at Kindbody. I want to introduce myself just quickly. I've always had a deep relationship with food ever since I was very little and started helping my mom out in the kitchen. And then later on, I became a professional chef, owning a catering business, etc. And this was many years before I decided that I really want to focus on the nutritional aspects of diet. My mission became to educate and guide and support women throughout their health journey, and of course, make everyone fall in love with food. Today, I'm here to talk about fertility and nutrition. Why is it important, and what are the main pillars of a balanced diet? And starting with, yes, prenatal nutrition provides the base for a new life. We all know that nutrition is extremely important during pregnancy to support the development of the baby, and later on during lactation for the baby's optimal growth. This is kind of obvious, but I feel like throughout the years, I've noticed that very few clients were aware of having actual power over their health and reproduction. For example, nutrition and lifestyle is extremely important to prepare the body for pregnancy. And this includes preparing your body to have regular periods, healthy ovulation, and healthy conception. These are, anyway, the first steps of this process. So in order to mature and release a healthy egg during ovulation, it's vital to have adequate proteins, healthy fats, and carbs in your diet, along with micronutrients such as B12, iron, and CoQ10 that Meredith just mentioned. On the other hand, for optimal conception, we need vitamin D, A, B12, folate, iron, and zinc. And guess what are the most women deficient in these days? Exactly, it's iron, vitamin D, B12, folate, and zinc. Also, common chronic conditions such as metabolic disorders, hormone imbalance, inflammatory diseases can also all negatively affect our reproductive systems. Balanced diet and the lifestyle changes are extremely important of part of healing these conditions and the healing process with these conditions. You may probably ask by now that, okay, but what's the best time to start preparing? And pretty much the answer is now. The baby's major organs are starting to develop before you even know you are pregnant. That's why I can't stress enough how important preconception and pregnancy nutrition is for a healthy pregnancy. And as I also mentioned above, to release a healthy egg and healthy conception to happen, we need a lot of nutrients to be present at that moment. So in case you're deficient, your body needs time to replenish and restore these storages. This can take months, sometimes even up to 6 to 12 months. So you need time to prepare. And you also want to make sure that these stores are filled up all the way to the brim so they last through this journey of conception, pregnancy, and postpartum. And going off to the next slide, this preparation is about adapting and continuously using a balanced diet and lifestyle. Now, what is a balanced diet? You must have heard probably 1,000 times that eat real foods, and it is true, and that is a balanced diet, a colorful, versatile diet that includes adequate amounts of protein, healthy fats, and carbohydrates, and also minimizing your consumption of processed foods, sugars, and refined carbohydrates and oils. The four main pillars, as you can see, of a balanced diet here are a good quality protein, healthy fats, carbohydrates, especially fiber, and hydration. Now, what is protein and why is it important? It is literally the building block of every single cell in our bodies. It builds our bones, muscle, cartilage, skin, and even blood. It's required to make enzymes, hormones, and other body chemicals. Adequate amount of protein is needed for optimal fertility. And for example, animal proteins are very important for iron and vitamin B12. There are studies that show that glycine, which is an amino acid, is vital for cardiovascular health of the mom. It may prevent preeclampsia, and it builds the baby's cardiovascular system, which is pretty amazing, right? Other studies might show that I've read shows that diets rich in plant protein can improve ovulation. So foods such as legumes and fermented non-GMO soy products like tempeh is a great option. Healthy fats. Both saturated and unsaturated fats are very much needed for healthy cell walls, our nervous system. So talking about depression and mental health, it's very important. Hormone production also very important for producing all the sex hormones and to build a baby. Essential fatty acids such as omega-3 and omega-6, we don't make these, so we have to get them through diet. And omega-3 has been shown to improve egg and sperm quality, and it may also lengthen our reproductive lifespan. Try to eat fats in their original forms. I always tell this to my clients, like avocados, olives, nuts, and seeds. These are always the least processed, and it's very good for you to eat them in their original form. And the other good rule of thumb, which I always tell people about oils, is that everything that's over 1,000 years old and still being used is basically proven to be healthy for us. The rest is pretty much experimental. So these oils would be olive oil, coconut oil, and ghee, the clarified butter. Over to the carbs and fiber. Carbs are a great source of quick energy, and let's be honest, we all need that. And fiber, they are loaded with critical micronutrients such as high amounts of B vitamins, folate, zinc, iron, and even antioxidants. Fiber has an important role in hormone balance, and it can also prolong the luteal phase, which is the post-ovulation and conception phase. And how it helps hormone balance is it helps eliminate excess estrogen from our bodies. So people with estrogen dominance, having a higher amount of fiber in their diet is very important for eliminating, detoxifying the excess estrogen from the body. Hydration. Drinking enough water will basically keep our cells happy and help our organs to function properly. It is important to balance blood pressure, balance blood sugar, and it's also needed to the adequate hydration to make blood and then make amniotic fluid while you're pregnant and then produce milk, adequate amounts of milk when you're lactating. Also, interestingly, if you drink enough water, we also produce more cervical fluid, which is good news for the sperm on the way to the egg, on the journey to the egg. After the next slide, I'm going to give you examples of these 4 main nutrients. So here we have basically the 10 key foods for fertility. And I'd like to start with proteins. And I also want to mention that there is a whole lot of information about this, and I'm just trying to not to overwhelm you all with all this information, so try to keep it short. But here we start with organic pasture eggs. Eggs are amazing and they are superfoods. They have both protein and healthy fat, which is what else do you need, right? Like that's so amazing. So don't be scared of eggs. Eggs are great for you. They are rich in fat-soluble vitamins, which are all very much needed for fertility, vitamin B and choline. And choline in eggs is very important for the brain development of the baby, for example. Also, fun fact that eggs are the only non-seafood source of omega-3, specifically DHA, which is amazing news for people who don't like fish. And next up, we are going to the organic grass-fed meats. These are animal products that are free of hormones, antibiotics, and GMO grain, which can all unfortunately harm our reproductive systems and our health in general. The highest amounts of complete protein are found in meats. Free-range chicken, beef, lamb, pork, turkey, organ meats, if you don't mind, game meats are all part of a balanced diet. Legumes, next up, contains minerals mentioned earlier that a lot of women are deficient in, and also an amazing source of fiber. These are chickpeas, beans, peas, and lentils. Continuing off with healthy fats. So here we have wild, sustainably caught fish, high in essential fatty acids, proteins, vitamins, and minerals. Cold water fish is loaded with omega-3, and omega-3 has an anti-inflammatory property which is needed in cell health and also in the DNA synthesis after conception. When you think about fish, try to buy wild, and then also try to focus on eating smaller fish to avoid mercury toxicity, because bigger fish could just contain more mercury. And next up to avocados, everyone's favorite food, I hope. It's an amazing source of healthy fats, and it also contains a lot of fiber, which is really important for gut health, regular bowel movement, and hormone balance, and also regulates blood pressure. Potassium in avocados is needed to regulate fluids and minerals that comes in and out of your cells. So that is very important. And carbs, we have dark leafy greens. These are everything that you can imagine that are green: kale, arugula, chard, collard green, spinach, watercress, dandelion, beet greens. These provide micronutrients that are strongly associated with optimal conception and also lowering the risk of birth defects. Vitamins and minerals are involved in every step of maternal, placental, and fetal interactions. And these are also great source of fiber. Whole grains, these are the minimally processed grains. Since they are not processed, they are more nutrient dense than refined grains. They contain amounts of B vitamin, iron, selenium, and magnesium, and provide us with energy and helps the placenta grow. A good example how nutrients help with symptoms, which are you can see, so you can actually, it's proven, is having oatmeal and bananas, for example, while you're pregnant. Since it has a lot of B6, it can help to prevent and ease the symptoms of morning sickness, which is amazing. So this is how you can see how food can control so many things in our bodies and symptoms and what happens in our body. Next off, we have organic berries, and I'm sure this is also everyone's favorite. They are super delicious and loaded with antioxidants. These antioxidants basically protect our cells from oxidative damage and also supports our immune system, nervous system, digestive system, and circulatory systems. So when it comes to berries, try to buy seasonal berries, locally grown if you can find them, and then any of those: blueberry, blackberry, raspberry, strawberry. These are all amazing sources. And also, I also have two more, which I like to call booster foods. I call them booster foods because they have super strong healing properties and provide extra energy. And also they don't need to be consumed in large quantities, yet they have amazingly strong impact. So this is, one of them is fermented foods, probiotics. These are extremely important for gut health, and gut health has a major impact on every function of the body, basically, including hormone health and fertility. When we think about fermented foods, it could be sauerkraut, kimchi, yogurt, kefir, and even miso. Even though we have it in small quantities, it's still a great food. And then the other one we have is bone and mineral broths. These are slow cooked broths that made out of the bones and skins of healthy animals, or the mineral broths are containing a good variety of vegetables, and these are basically liquid gold. They contain amino acids, a ton of minerals, which are important to basically build and break down all of our cells, tissues, bones, blood, everything in our bodies. And these nutrients support our immune system, reproductive system, and they've been used for thousands of years. And also very highly recommended to have bones and mineral broths later on after giving birth throughout the postpartum period to heal and recover the body. So this is all what we have for today. I could talk about these for weeks. So if you are interested in hearing more and of course, customized advice from me for your specific needs, then feel free to go ahead and check out my services on the Kindbody website. Thank you so much.
Krista, thank you so much. And I have to tell you, there are so many questions. I immediately was like, okay, we need to do an entire event dedicated to nutrition. Like it's so magical, the information that you have to share. And I really want to do a deep dive. We have questions about fiber. What is the best cooking oil to use? I mean, I could go on. And I love that I can see your kitchen behind you, because I think it is important. You're not a nutritionist who doesn't eat. Cause I'm always scared when they say nutritionist, I feel like it's someone who eats a Wassa cracker and a piece of like endive and calls it a day. So I love that you're a food person and you enjoy food and your passion. And honestly, that's why I was so happy to have you part of our team. And so we'll talk about it more in the end, and we're going to address as many questions as we can today. And then it also will give me an idea that maybe Krista and I do a video for IG Live or something where we can share more information, because we have
Absolutely.
so many incredible speakers, and I want to talk to Judith and stress about it. There's just a lot, too much we want to cram in one day. But thank you so much, Krista. And I'm going to
thank you so much.
Yeah, thank you so much. Really talk about stress in your cycle. And if you want to book with Krista, you need to email navigator@kindbody, because she literally just joined us. We've been in talks for months. We've been best friends on Zoom for months, but now we're legit. She is on our team, and I'm so happy. So Meredith, will you take it away, friend?
Yeah, thank you, Krista. That was great. That was great. So our next speaker is Judith, and Judith has been with us at Kindbody for a while now, and she's one of our therapists that helps to support our patients, I think primarily on the East Coast in New York. But she is going to talk to a little bit, I'm going to actually switch slides here, a little bit today about emotional health, stress, and how therapy and supporting your mental health is helpful, and specific ways to do that, whether you're, like I said, either in your fertility journey or during a fertility cycle. So thank you, Judith, for being here with us today.
Hi, everyone. It's so great to be here with this great team. I'm really honored to be with all of you. And I'm really glad that Meredith Brower started out by talking about the fact that inherently dealing with fertility is stressful, because becoming a parent is one of the most, intense desires we have as human beings. So it makes sense that we're going to be stressed about it, and anticipating the process or hitting roadblocks can be distressing. So even though we know that stress is a part of it, we're going to give you coping mechanisms to make it better, but it doesn't mean it's going to go away, and you don't really need to feel like it does have to go away. We're just going to try and minimize it. So one of the ways to consider taking care of yourself is to talk to other people. And it's really helpful if you talk to people who have been through it or are really knowledgeable about it, because if you talk to a lot of people who haven't had this, they'll just tell you, go on a cruise, have a drink of wine. They give you information and suggestions that are not helpful. So you want to make sure that you have some people on your team that really understand. Either they've been through it before or they know a lot about it. I think that's so important. You also want to minimize the time, or at least be careful about the time you spend on social media, because it can be helpful. You can find groups that have other people going through a similar process, and that can be helpful. But it can also be stressful because you hear a lot of negative outcomes. You don't know where that person is coming from in their own process. And you can start comparing yourself. Oh, this person got pregnant on her first IUI, and how come that didn't work out for me? You also want to make sure that you are monitoring how much time you hear from people who didn't have fertility problems and are taunting their beautiful life with their children. And, you know, it's a time when friends and family are really talking about babies and family life, and that can be so hurtful. So use social media with careful thought. You also want to think about what kind of resources are out there. And here I want to put in a plug for therapy or counseling, because it's really helpful to talk to someone who is completely on your side and doesn't have their own agenda or their own ideas of what you should do. And if you struggled with any mental health issues previously, they can get triggered by this process, and it's really a great idea to have someone in your corner. If you and your partner are in agreement on the best approach, or if you feel like you're fighting all the time or not seeing eye to eye, it's a great idea to get some couple counseling just to help you start to see things in the same way and to be on the same team, because you don't want to feel like you're on opposite sides of this process. Another thing to monitor is if you're not getting enough sleep and nutrition to really take care of yourself. Stress and anxiety can certainly promote, you know, insomnia, and lack of sleep causes all kinds of negative bodily processes. So sometimes having a place to talk, to lay out what's going on, and to have someone support what you're going through can really help with your sleep. And the other thing is, you don't have to be in dire straits to seek a counselor. Sometimes it can be a really impactful experience just to have a place to talk where no one is going to tell you what to do. And so thinking about strategies to promote well-being, you want to honor what you're going through and not try to talk yourself out of it, and don't let other people talk you out of it. If you're feeling sad, depressed, anxious, excited, whatever it is, just be there with it. And know that there are aspects of our lives that we can't control. I mean, I don't think any of us expected that we would be still quarantining and still wearing masks and looking at another year, possibly, of that kind of behavior. So we have to recognize that there are certain things that we can't control and sort of let go. And if you're a type A person that is used to being in control of everything you do, this can be a real challenge. You want to stay connected with family and friends and coworkers who are supportive. You know, and I always tell people, this is a time when you can give yourself permission to say no. You don't want to go to that, you know, party, or you don't want to go to that, even if it's virtual. We all can go to anything now because it's virtual, but if it doesn't feel like it's going to be helpful to you, you can say no, and you can make up an excuse. You really have to take care of yourself. Sometimes it can be really helpful to distract yourself by learning something new or revisiting a former interest that you hadn't had time to do. And you want to really focus on your breathing if you can, and have a mindfulness practice. And it's different for everybody. You know, some people find meditation and yoga to be perfect for them, but it doesn't work for everybody. You can also do, you know, you can walk, you can listen to music. You can be, maybe you're one of those people that loves to draw or do crafts. But you can do almost anything in a meditative and mindful way that can help your mind, body, and spirit. Another thing that is so helpful is spending time in nature. And all kinds of studies have shown that being in nature is restorative in so many ways on all parts of your being. And, you know, you don't have to go to Yosemite, although it's great if you can, but you can go someplace even just nearby and find a tree, or watch the birds, or, you know, listen to the birds that are coming out in the morning. I mean, there are all kinds of ways to let yourself take in nature. And just remember that, you know, we're all connected and we're here for you. And the Kind Body team is incredibly supportive and really wants to take care of your whole self and not just the fertility part of you. So let us be there for you. Thank you.
Thank you, Judith. That was great. I think, you know, I'm sure we have questions, but I think a couple things that you said are just so poignant. I think for anybody who's ever had any kind of fertility journey, long or short, it's very true that unless somebody, it's such a unique kind of trauma, I might say, that talking to people who have been through it is so different than even talking to your best friend, the person you love the most in the world who hasn't been through it. I think that's helpful. And I also think that, you know, some people have a different, some people love therapy and some people are afraid of therapy. But I do think, you know, most people who are having any kind of journey can probably benefit from it, even if it's just short term. So thank you for sharing all of those tips.
Thank you, everybody.
Appreciate it, and we appreciate you. And we have just a little bit more time. We have our last speaker today, Josephine, who is going to share with us some strategies and tips in mindfulness, which is, as Judith mentioned, one of the a very effective coping strategy for many people as they're experiencing any kind of stressful experience, but this stressful experience in particular. And she herself has had quite a journey. And so I think she can sort of tell you a little bit, but she, you know, her journey, she had her own very long fertility journey that involved everything from IVF to an adoption, to loss of babies, and even surrogacy. So she comes certainly from a place of experience and knowing what this journey is like, and has used meditation, and is now going to teach us a little bit more about how we can do that as well. So thank you, Josephine, for being here with us.
Thank you so much for the introduction. So as Meredith mentioned, my fertility journey encompassed 13 years, and it involved IVF, and then loss of twins at 17 weeks. And from there, we pivoted on to international adoption. And that's when we were able to welcome our first son into our lives and start our family. And then about a year or so later, we then decided to try IVF one last time. And that's when I became pregnant with twins again and carried those twins to term. And then many years later, you know, we had all of these frozen embryos that we worked so hard to create that we kept frozen, and I couldn't carry again. So we saved up and we ended up doing surrogacy, and our amazing surrogate carried another set of twins for us. And that's how we came to have our family of 5 today. And it was during this process that I really didn't, back then, you know, this was almost 20 years ago, I didn't have any of these great techniques in my self-care toolkit, which is something that I advocate for a lot with my clients, which is to have a number of tools at your disposal to help you through this long, what can be a very long and arduous process. And one of the things that I wish I had back then was the ability to use mindfulness. And what is mindfulness, for people that don't know? it's essentially tuning into something. So usually it's the present moment. It can be something such as your breath. It can be a mantra or a phrase that you use to keep you grounded into the present moment. Or it can be something in nature, which Judith had mentioned before. And all of those things that you're using as your point of awareness and focus help to keep you in the moment. And it helps you from spiraling out into negativity, and helps you return back into a state of positivity, a state of calm. And that you can do it through many techniques. One of the techniques that I like to teach my clients is using breathing techniques. And the beauty of using a breathing technique is that you can do it both in a meditation, but you can also do it anytime you are at an appointment. For example, I'll use it now when I'm sitting in the waiting room, or you can use it, when you're getting an ultrasound done. And it's a great way to tune into the present moment. And it's a great way to start to relax your body and your mind, because you'll find yourself getting worked up and you'll start to enter into a state of stress. And the gateway to go from a state of stress into a state of relaxation is our breath, because our slowing down our breath tells our mind and then our body that we are no longer in a state of fight or flight. We are no longer feeling stressed out because we're slowing down our breath. And then we can then shift over into that more relaxed, or as they call it, the rest and digest state. So I have two examples of breathing techniques that I love to introduce to people who've never really tried it before. One is called the 16-second breath. And we can do this right now as we are here in this great event. I'll ask you to breathe in right now for 4 seconds. And then hold your breath for 4 seconds. Exhale slowly for 4 seconds. And then hold your breath once again for 4 seconds. And the wonderful thing about this, and you can continue doing this on your own as I continue speaking, is that in that moment, just 16 seconds, because we were keeping track of the timing of our breath and making sure to pause in between, it's really hard for your mind to think about anything else. Think about any of the stressors, any of the things that you have to do, anything from the past that's weighing you down, anything from the future, all of those what ifs, like what if this doesn't happen, what if that happens? You couldn't think about it in just those 16 seconds if you were following along, because you're focused on that breathing pattern. And another one that I like to try or coach is called the ocean breath. And when you think about the ocean, the waves are coming into the shore, but you never really stop. The water doesn't really stop. As soon as it comes in, it just floats back out. And that's what we're going to do with an ocean breath. So begin to inhale. And as you're inhaling, just do it as slowly as you can, just at your own pace. And then right as you're about to exhale, just float that inhale straight into an exhale without any pause. And it's kind of like an infinity sign or the ocean coming in and out. And then you just continue to do that at your own pace for however long you need to. And that's the beauty of these breathing techniques, is that you can do it for as long as you need to. You can do it during a meeting like we're having. You can also use the technique when you're speaking to someone in real time and they're speaking, they may be triggering you, but by doing that breathing technique as you're speaking to them, you're allowing yourself to return back to your baseline level of calmness instead of being triggered by whatever it is that they're saying. And the beauty is that then when it's your turn to speak, your turn to respond, you're coming from a more positive, a more relaxed state of being. You could be more mindful of how you then proceed in those next steps. Another technique that I like to teach my fertility mindfulness clients is the use of affirmations. And what is an affirmation? Essentially, it is just a statement of support and empowerment. It can be used to give you confidence, and you simply can just say it to yourself, both in a meditation or out of a meditation. I like to advise my clients to say it to themselves as they're sitting in the waiting room, or if they're about to do a procedure, such as a blood draw, an ultrasound, or if they're having an egg transfer, just saying phrases that really resonate to you and your own journey. Ones that, as you see on the screen, that I really love are, I am safe, I am healthy, I am worthy, I am strong, I am calm, I am loved. Other things are, I am enough, because oftentimes we just feel so lost, we feel so lonely, we feel very overwhelmed and frustrated. I know that's how I felt during that really long journey that I had. And saying these phrases just over and over to yourself, whether or not you believe them right in that moment, if you keep saying them to yourself in a meditation or out, then it just starts to take root in your mind. And eventually you'll get there, because whatever we put our attention to, the mind starts to bring in. And these are especially great right now because a lot of times partners aren't able to be your source of support at appointments because they're limiting the number of people in the facility. And so by using an affirmation, you can be that support system that you need at that time. And so again, the breathing technique, the affirmations, they're all things that you can use in a quick meditation or outside of one. And if you've never meditated before, you can quickly try just by doing it a couple of minutes a day. It doesn't have to be, it doesn't have to be in a special place. You don't have to have special music. We're fortunate that there are a ton of apps and that can help guide you. And there are also a lot of free online meditations that you can follow. And the other quick misconception that people have is that your thoughts are supposed to disappear. And, that really isn't something that happens. It's actually an ebb and flow of thoughts. So you'll start to calm down and you'll start to get into a moment of stillness and silence, which is great. Then all of a sudden you remember something that you have to do tonight, something that you have to email or cook, and then you lost that stillness and silence. So in that moment, be kind to yourself and compassionate, and then remember to just gently acknowledge the thought, allow it to float away, saying that you will get back to it when you can, and then return back to your point of focus, whether that's your breath, whether it's an affirmation or a mantra, whatever it is that you are using as your anchor and your grounding moment, and use that to return back into this meditation that you're doing. And just one last thing about that is that it translates over into real life, because so often we're doing so many things at once. But if we can just allow ourselves to practice the art of being present, then we can be really mindful of where we are and what we're doing and who we're speaking to and the information that they're giving to us. Especially, for example, like if you're at a doctor's appointment and you received maybe news that isn't favorable and you find yourself spiraling. Well, by practicing mindfulness and meditation, you're able to then practice in that moment, returning back into that conversation, using your breath, using some mantras or affirmations, and really engage in that conversation and figure out what your next steps might be. So I encourage you to give these strategies a try. As I said, there are many resources out there that you can use for meditation and mindfulness to help you along on your journey.
Thank you so much, Josephine. And an extra treat that Josephine is providing is a fertility meditation. And so please make sure we're not spamming you when you get the emails from us. Rebecca and I work really hard to make sure that we're not sending you a bunch of junk, but we do have a follow-up email after this event. Click on it, because then you could really see more information about our speakers. And then we'll have a link to Josephine and her wonderful meditation that she's provided. And then she also has these affirmations. She has it as a social media sized image. So you literally can save it in your photo roll, which I thought was a really great idea. So when you're in an appointment or anytime that you really find yourself going to a place of wildness in your thoughts, that you can really use these affirmations. And Josephine, I hope my team doesn't notice when I'm doing ocean breaths in the middle of meetings now for moving forward. But everyone, we really want to say, I know we're already up to 1 o'clock, like time goes by too fast, and we want to spend all day with our friends and talk about fertility. But thank you everyone that has joined. Meredith, I think there's a couple. So something that we really wanted to offer, because we have Krista and Judith, is that we're going to offer a 25% discount for anybody that wants to book sessions right now. And then for Krista, you need to email Navigator and they'll get you set up with her. Judy, you can just book her through our website. She's been with us really since the beginning on this wonderful rocket ship of Kindbody. But we really want to say thank you so much. And then tomorrow, again, Meredith is going to be with us. We're going to talk about different medical conditions such as PCOS, endometriosis. We have a naturopath doctor that works with us. We have our acupuncturist, and we're going to do a deeper dive on that side of the scope of fertility. And then especially since all of our comments, Krista, you are tied in. We are going to do another nutrition event. It looks like we need to do some fitness. Believe you me, I absolutely need to participate in any sort of fitness at this point. But thank you. And I hope we've answered most everyone's questions. We're really going to continue to have this conversation, and we're really looking to launch our Kindbody community shortly, because I feel like we never get enough time in these events, and we really appreciate everyone's participation, because honestly, like I said, everyone that's asking a question, I promise you there's 10, 15 other people that have the same exact question. So know that in this space, everyone is supported and everyone is seen, and we really appreciate everyone for attending. So thank you, Krista. Thank you, Judith. Thank you so much, Josephine, for joining us. And Dr. Brower, do you have any closing comments for us? She's muted, unfortunately.
There, sorry about that. I'm gonna stop soon. No, thank you so much again for everyone for joining us, and we will be back tomorrow to talk about wellness as it pertains to specific diseases. So I'm excited about that.
Noon Pacific, 3 p.m. Eastern. So we hope everyone can join us. And then if you can't, go to YouTube, but we ask that you subscribe to our channel so we don't look like we only have 4 followers. We know you're out there. So just join us, and also follow our Instagram, because Rebecca's always putting new content, and kind of in the moment, we're going to start doing more IG lives and continuing to add all of our supplemental services and be able to share with you. So thank you again, everyone. And we're so excited and hope to see you tomorrow.